The regular agenda is the COVID update by Janelle Linn. We're excited to have Janelle serving here now as our County Health Director. And Janelle, welcome. And this time we'll turn the time to you for a COVID update.
Thank you, Chairman Seymour, and thank you to the other members of the board. Since Jeff last presented to you on December 8th, we have had 3,619 new COVID cases diagnosed since that date. Today, Navajo County was at 12,675 confirmed and probable cases. For the state of Arizona, we're at 627,541, and 8,995 of those were in the last 24 hours. Navajo County had 103 new cases identified in the last 24 hours. And currently, right now, off tribal lands, our public health nurses are monitoring 787 households. And those households either involve infected cases or isolating direct contacts of an infected case. So we are still really encouraging wearing of masks, social distancing, hand hygiene, and staying home when you're not feeling well. We have not, we feel, reached the peak of our second surge. And so I know everyone has COVID fatigue and these things are seeming tedious to some, but we're strongly encouraging individuals to please consider those things and practice those behaviors. We've been working very closely with our schools throughout our COVID response efforts, discussing their positivity rates in their community, rates per 100,000, keeping them informed on the status of our hospital capacity here locally. Yesterday, the governor made an announcement involving schools and funding of schools in relation to distance learning versus in-person learning. So that we are waiting to hear from ADHS for more guidance, how that is going to impact the benchmarks that were set for schools and how we can better facilitate those conversations and need to adjust the things we've been doing. So we will be waiting for that and working and reaching out to our schools to see if we need to adjust things. Tier 1B for vaccine opened on Monday. Tier 1B, it's been added to Tier 1A. So we didn't close Tier 1A down. We just added Tier 1B to the group of individuals that are eligible for vaccine. Tier 1A involved healthcare workers of all kinds and individuals who lived or worked in congregate settings. And Tier 1B includes law enforcement, first responders of all kinds, fire, EMS, protective services and educators, school staff, healthcare workers that were not encompassed in Tier 1A, adults 75 and older, and essential employees who work for organizations such as food and agricultural services or power companies, individuals who are essential to us being able to perform our daily tasks of living. We are being very upfront in letting people know that we're experiencing already vaccine shortages. Our demand has surpassed our supply now that we have moved into Tier 1B. We are asking everyone to be patient, from the facilities that we work with to the public. And we expect that it could take us quite some time to be able to move through and vaccinate all of Tier 1B, just mainly due to the shortage of vaccine. We are at the mercy of the state, who's at the mercy of the manufacturer and the federal allocations. And we request every week. We talk to our partners, get their requests, and we put those requests forward to the state health department. But we are at the mercy of what's allocated to us. Our first allotment early in January was 2,800 doses. So we were hopeful that we were going to have steady supplies of vaccine. We've had 3 allotments since that, and they've been between 400 and 600 doses. So we saw a huge difference in our continuing allotments. So we're doing the best that we can do to push those out as quickly as possible, but we do ask for patience in that process. We are asking that people register for vaccine, that they please not just show up to vaccination sites. Because we have a limited vaccine, we're not scheduling more appointments than we have vaccine to provide. So vaccines are being done through various facilities in Navajo County. Indian Health Service has vaccine for tribal members, Summit Healthcare, Little Colorado Medical Center, North Country, the Safeway Pharmacy in Show Low and Winslow, Change Point has some vaccine, and Calls Pharmacy in Snowflake are our key onboarded facilities right now that are helping us push vaccine out into the community. Here in public health, we are focusing on contact tracing and patient monitoring and utilizing the strong relationships we have with our community partners to facilitate actually vaccinating the public. You can go to the county's COVID dashboard. There's information about the vaccine there, information about registering and how to do that. You go onto the link and register. If there are clinics available who have vaccine and have remaining appointment slots, once you've moved through that registration process, you'll be able to schedule an appointment. If all of the clinics at the time are full, you won't see options there, and you would need to keep checking back on that site until you find a clinic that's open. They're constantly adding them as vaccine comes in, so that changes regularly, and the facilities open their own clinics and add them themselves. So we don't always know when one is going to be added to the queue to be able to schedule. In Tier 1B, we've been experiencing some concerns of individuals being able to register, especially with some of our senior population who either don't have access to technology or may struggle a little more using technology. The state is utilizing the same 211 hotline that's been open throughout COVID, and they are able to help register if there are clinics open and appointment slots open at the time. We've also reached out to our local library network and are working with them. So far, the Pine Top and Show Low libraries are able to help people register and provide them access to technology. We're working with our partners at NPC, the staff that can help us be able to register, and are working to get that up and running and in place. And then we have also reached out to our local senior centers and provided them with education so that they can assist people who are interested in registering for a vaccine and need assistance. At this time, we are being told that when we are allocated a first dose shipment, we are guaranteed an equal allotment 3 weeks later to ensure that individuals receive their second dose and are able to complete the series. This is the first week that our community will receive its second dose allotments. So we're looking forward to seeing how that goes and working with our partners and getting feedback from them on if that was an easy process or if we need to maybe tweak or fine tune some things. We are anxiously listening for the transition of power at the federal level that may bring changes in how vaccine is rolled out. We're not sure. We will keep you definitely posted as we hear more and if changes are going to occur. Those are our primary COVID updates for this week. Do any of you have questions?
Any questions of members of the board or public? Well, Janelle, I appreciate your report. It's a fantastic job you and your team is doing, and we just appreciate your efforts of being on the front line. And I know it's been a tiring process for you, but congratulations in your new position here, and we know that you'll do a great job. So
Thank you. I appreciate your support.